I'm Dr. Sandra Brown. I'm an ophthalmologist in North Carolina, and I have no financial conflicts of interest. I'd like to talk to you today about your doctor's path to acceptance of biologic eye drops. It works because they say it does. Part 2, bias. Why your doctor believes himself. As a reminder, they equals key opinion leaders, trade journals, conference speakers, and social media. They does not include the Food and Drug Administration. Snail says, hey, I'm calling you out on that goddess of pediatric blepharitis comment from the previous talk. And I'm going to say, that's fair. But the way I treat pediatric blepharitis is off-label. It's not no-label. Generally accepted medical practice is on my side. And also, science is on my side. As an example, all the drugs that I prescribe have been FDA approved for room temperature storage. And those of you who've watched a number of these videos will get the joke. Let's talk about Dr. Z's super busy dry eye practice. He sees about 70 patients a day, which results in an average face time of about 5 minutes. And just so you know, there are companies and organizations out there that will help your doctor to become a dry eye specialist. What are Dr. Z's stats? In the past 4 months, he's recommended biologic eye drops to about 500 patients. Of those, 250 kept a return appointment, and 200 were actually using the biologic eye drop. 10 actively complained about it. Dr. Z's mental count clinical experience says 200 of 250 patients were using biologic eye drops. This means that 80% of them were happy and the product was successful for them. 10 of 250 had some complaints about it. That's a 4% complaint rate. Well, those statistics are as good, if not better, compared to most other FDA-approved treatments. So hey, biologic eye drops rock. And this is where I talk to Dr. Z. And this is what I would say. So, Z, half of your patients were lost to follow-up. Maybe they didn't get any benefit and decided not to see you again. Z says, 80% of my patients love it. I say, of the 50% that you got feedback from. Z says, why should I assume a lower rate of success? And I say, why should you assume the same rate of success? Hey, Z, this isn't a personal attack. We're just exploring your assumption. Let's just acknowledge its existence. And Dr. Z says, well, Dr. Key Opinion Leader has had wonderful results too. At which point, I have to go lay down. Time for more prescription bed rest. So what's wrong with Dr. Z believing himself? Well, the validity of his own personal experience is affected by a couple of types of bias and a conflict. There's ascertainment bias, confirmation bias, and financial conflict of interest. The next few slides don't have any funny graphics, but I'd ask you to stay with me because I think this will make you more sympathetic to your doctor's suggestion or pseudo-prescribing of biologic eye drops, especially if you've watched my other videos and understand why I think that's a bad idea. First of all, doctor memory makes for lousy data. Dr. Z recalls how many times he recommended biologic eye drops. He actually has data on 50% of all patients to whom he recommended biologic eye drops, and he has no idea what is happening with the other 50%. This leads to unacknowledged ascertainment bias. Ascertainment bias in this case means that there is an assumption that the patients you don't know about had the same response as those you do know about. But this is a very dangerous and unsupported assumption. And the lower the percentage of patients giving direct feedback to your eye doctor, the less credible his opinion is based on his own personal clinical experience. Let's think about which patients might not come back to Dr. Z. First, there are those who did not follow his advice. Maybe it was too expensive, maybe the patient was too skeptical, or they just didn't. Possibly the patient did follow Dr. Z's advice and did not perceive benefit. Why make another copayment to a doctor who didn't help them? And these patients may be even less likely to return if there was no perceived benefit and the biologic eye drop was the primary treatment recommendation, was described as extremely effective for most patients and described as having minimal or no side effects, and the patient experienced one. So here's a treatment which has a lot of hype, cost a ton, didn't work, or hurt. That patient may not really have a tremendous amount of residual faith in Dr. Z. Ascertainment bias favors positive recall, which is to say, happy, improved patients may be more likely to return, unhappy, not improved patients may be less likely to return, and patients who did not order biologic eye drops at all may be less likely to return, especially if this was the primary treatment recommendation. If your doctor says to you, hey, use this, it works great for most of my patients, you price it out and can't afford it, are you very likely to go back to him and say, well, I didn't use your wonder treatment. What else can we do that's less expensive? I'm a doctor, but I'm also a patient. And I see myself in these types of patients, and I know that I would have a significant emotional or mental threshold that would not favor returning to see Dr. Z again. And there are some other things we don't know just from Dr. Z's fine mind. 250 patients were seen again. 50 were not using the eye drop. 10 complained. 40 didn't complain, they just weren't using it. Why not? They never started, they started then stopped. Z doesn't remember that. 200 were using it, but how many were actually improved at the time of the follow-up visit versus still waiting for benefit? And here's a key factor. How many patients had multiple treatment changes on the first visit? Because if 4 different things were changed and the patient says, hey, I feel better, how can anyone possibly know which one of those treatment changes was effective? Let's contrast Dr. Z's memory with a phase 3 clinical drug trial. First of all, almost every patient who is enrolled in the trial is accounted for. The trial is going to report how many patients completed the trial, stopped participation with an exact breakdown of the reasons why. The trial will describe the degree of benefit. It will list side effects not leading to stopping participation. And critically, the trial design generally prevents the initiation of confounding treatments, or there may be very tight parameters for those treatments, and patients who had the initiation of a confounding treatment may be analyzed separately. And this is all in a very strenuous effort to isolate the benefit, lack of benefit, side effects, lack of side effects, or adverse events, which can truly be attributed to the clinical trial drug. There's also a data safety monitor and the extremely critical double-blind study design. You can learn more about that in videos titled The Placebo Effect. Dear patients, if you are using a biologic eye drop, currently you are the only source of information about BED effects, side effects, and complications. There is no other data whatsoever. You're it. And Snail has coined the regenerative medicine motto, direct to phase 4. Save time and money by skipping clinical trials. What about the next kind of bias, confirmation bias, which is also known as human nature? Confirmation bias is selectively gathering and interpreting evidence to conform with one's beliefs, as well as neglecting evidence that contradicts them. And I want to emphasize that this is not purposeful or conscious. Confirmation bias means that Dr. Z recalls patient feedback that supports his preformed belief that BEDs are very beneficial and have minimal side effects or complications. Here's a good graphic. Objective facts, that's all the facts, in the blue circle. In the red circle, everything that confirms your beliefs about anything. And the intersection of those two circles is what you are going to see. You're going to see the objective facts that confirm your beliefs. You're not going to see those that do not confirm your beliefs. This is confirmation bias. Once again, confirmation bias favors positive recall. Doctors and staff want to hear good news. We really do. We really want to hear good news. It's a whole lot easier to deal with than bad news. So there's a tendency to joyously document this. Doctors and staff don't want to hear bad news. Now, the very best kind of doctor is going to suck it up and deal with your bad news. Look right at you and say, okay, what we tried didn't work. This is the next step in the plan. And that bad news is going to be documented. But confirmation bias, just working from memory, doesn't lead to a lot of documentation of unhappy patients with negative results. And this is particularly true if the patient doesn't open their mouths and say, I did not like this because X. It stung. It made my vision blurry for half a day. It cost a fortune. The bottle ran out in 4 days. Basically, no news is good news. So patients who aren't better but are still using a biologic eye drop are going to be classified as a success. Patients who had side effects but did not specifically complain about them are not going to be classified as having side effects. So educate your doctor. If you are using a biologic eye drop, clearly report and be sure the technician documents side effects from biologic eye drops. And please call MedWatch. There's the number. And then number 3, the elephant in the room, which is financial conflict of interest. In-office sale is explicit in the biologic eye drop business model. And you can see a screenshot below. This is the Blue Box product. If you are interested in stocking Blue Box and having a new product line for your office, please email or call us. Let's consider Dr. Z on the left. Dr. Z believes of himself, I am a compassionate, talented, experienced, cutting-edge specialist in dry eye care. I sell biologic eye drops because they work. In my office, I sell a fabulous biologic eye drop, $475 for a 5cc bottle. On the right, we have Dr. W. He's, honest with himself, and what he knows is, this is profitable glop, and I'm in it for the money. I'll quit selling it when they make me. And when he looks at that bottle on his shelf, he's looking at a profit of $87.50. Financial conflict of interest is going to multiply confirmation bias, and this is how it works. Dr. Z has the following beliefs about himself. He's compassionate, talented, experienced, cutting-edge, competent, ethical, intelligent, evidence-driven, not gullible, not greedy, and always puts the patient's best interest first. So if Dr. Z is going to sell a biologic eye drop, he must believe in it. Otherwise, he's no better than Dr. W, whom he knows and looks down on as a mercenary, marginally competent, possibly unethical, not nice person. Summing up bias in your doctor's personal experience. Ascertainment bias. Ascertainment bias means that your doctor tends to recall the benefit to patients who were seen again, assume the same degree of benefit in patients who were not seen again, and this is more likely false than true. Confirmation bias applies to patient feedback. Dr. Z and his staff recall good news, ignore or forget bad news, and no news equals good news. And then there's the confirmation bias multiplier of self-image. Dr. Z has to intellectually resolve the financial conflict of interest of selling and profiting from biologic eye drops in his office. He therefore cannot doubt that these products are safe and effective because he knows for sure that he is not a greedy doctor. And this leads to an interesting situation. Factual challenges to a doctor's belief in biologic eye drops is basically an attack on the self-image. And this attack on self-image is going to be very strongly resisted. And this may be the reason why the key opinion leaders, the relatively few that have agreed to engage in dialogue with us, have been absolutely adamant that biologic eye drops are safe, effective, wonderful, irreplaceable, and they think that Rebecca and I are bad people because we might cause these products to be no longer available. So let's connect all the pieces. First, chameleon marketing persuaded your doctor that biologic eye drops have the same level of safety and efficacy as all other prescription or over-the-counter eye drops. Next, Your doctor's belief caused you to believe, creating a placebo effect, which caused you to report benefit, which further reinforced your doctor's belief. Your brain became happy. Your doctor then formed his own independent positive opinion based on his personal clinical experience, which was influenced by the placebo effect, unrecognized bias, and financial conflicts of interest. This means rational argument may not change his mind. And for a review of those rational arguments, please see the videos Sludge and Sludge 2. Be smart. Call MedWatch if a biologic eye drop did not help, had side effects, even typical side effects such as stinging or burning, arrived with damaged packaging, was cloudy or smelled, or the manufacturer made the following misleading claims: that the product is FDA approved or has an FDA approved indication. And yes, for those of you younger than me, in the upper right-hand corner, this is a telephone. And below it is the phone number for MedWatch. Thank you for listening.